Hello and welcome to Indus Special. I'm Meshal Malik. The World Health Organization estimates that every 1 in 160 children suffers from an autism spectrum disorder. Many reports indicate that this figure is rising rapidly. What's alarming isn't just this figure, though. It is the fact that many individuals in the society are completely unaware as to what the autism spectrum disorder is. Today, we are going to discuss what is autism spectrum disorder and how to detect it. We will also try to explore life with autism, how it is for individuals, and what role society needs to play in accepting these individuals. Let me welcome our guests for today's show. Joining us today is Dr. Parveen Ilyas, who is a physician and a representative of Fountain House. And we also have with us Dr. Kanwal Salim, who's a clinical psychologist. Thank you so much for joining us. Dr. Kanwal, let's start with you. What exactly is autism spectrum disorder?
Autism spectrum disorder, basically it's a neurological disorder that encompasses majorly 5 disorders in this umbrella. That is pervasive developmental disorder, Asperger's, autism, childhood disintegrative, and others. The major symptoms of autism spectrum disorder are difficulty in social emotional reciprocity, restrictive, repetitive pattern of behaviors, maybe in trust, maybe activities, and issues with sensory, majorly 5 senses of a child.
What do you mean about issues with main 5 senses?
The child can be hypo or hypersensitive about his sensory needs. Visual, auditory, touch, taste, all the senses. So a child maybe cannot bear a light, or maybe he loves light, and that is abnormal in intensity, that it differentiates that child from the other kids.
So Dr. Kanwal, you're talking about how with autism there can be a great variance.
Yes.
So I'll take my next question to Dr. Parveen. Can you tell us about the degree of variation on the autism spectrum disorders? How many disorders come under that umbrella?
It's a neurodevelopmental disorder, and autism is the number 1. Asperger's, Rett's, and like Dr. Kamal has already described, that disintegrated childhood disorders. All those 3-4 entities, they come under this umbrella. But autism mainly covers the most of the spectrum of this neurodevelopmental disorder. Autism.
How does it cover most of the?
Like it's most. I think it's autism is a major and most common. And it's a neurodevelopmental disorder that begins at the age of 6 months and establishes at the age of 2 to 3 years. And it is triad of the symptoms. Triad of the core symptoms are the social, social development, delay in the social development, delay in the communication, and repetitive behavior.
So, Dr. Parveen, you talked about how it develops, starts developing at 6 months.
Yes.
So there are reports that state that there might be certain factors that a mother might have while she's carrying a child, which might make them more vulnerable or more prone to this disease. For example, if the mother has celiac disease, she's 50% more likely to have a child who is autistic. So can we say that this might develop even before the age of 6 months?
Usually it begins at it's very difficult to detect this autistic symptoms before the age of 6 months. At the age of 6 months, there is no emotional interaction with the caregiver, and there is no reciprocal emotional relationships, and the patient and the individual starts babbling at the age of 6 months. And it's difficult to, the child does not babble the words. And so there is no interaction with eye contact. Eye contact is lacking. So it's most of the time that mothers, it's very hard to really know before the age of 6 months.
And Dr. Kanwal, we're talking about how it's difficult for it to be detected, but autism, and I want to understand this better, there are more mild forms of it as well.
Yes, yes.
So it's possible that detection might not even occur at all.
No, it's not like that. Like Dr. Praveen is saying that at the age of 6 months, usually if a parent is very much involved with the child, he or she must know that there is something wrong with the child. If you are saying that maybe it is not detected even at the age of 3 years, it means that the very milder forms are present, and the diagnosis of autism is usually given when the daily functioning of a child is disturbed. Means if the diagnosis is not given, we can say that features are present, but the child is not diagnosed with autism.
Okay.
So features, maybe you can have some features of autism, I can have, anyone can have it. But when the functioning is disturbed, then we say that the child is suffering from autism spectrum disorder.
So there needs to be a physical manifestation for it?
Definitely.
Okay,
definitely.
for it to be. And it's true that autism doesn't have any distortion in physical features, or it's all to do with a learning disability.
Yes.
Can you tell us about the most common ways to identify autism amongst children?
If we see at the age of 6 months, the child will not give you the reciprocal smile, like the mother is smiling towards the child, but child is not giving her back the answer, appropriate answer. Maybe the child is not responding on his name, and these are the very initial signs. And as we move on towards the elder ages, then hand flapping as one symptom that is very common. Child starts hand flapping. Tiptoe walking.
That clapping?
Flapping. It's like this way.
Okay.
Okay. Then tiptoe walking, usually it is a feature of autism. Then the child may speak or may not, but if the child is speaking, he is using words, he will not interact with the parent. Parent is calling the child, but he will not respond to it. And so these are very common features which a parent easily can observe and assess that the child is not responding. And especially in the social situation, child is not responding to the instructions. Maybe in the social situation, he starts crying, he starts throwing tantrums, he is not liking the situation. Social situation is a major thing that usually parents tells us.
Dr. Kanwal, now when we're talking about children with autism, throwing tantrums in social settings is also something that's a very common feature of most children. But what's different about these tantrums?
Because the reason behind the tantrum is usually very different, and when we deal with the parent, they tell us exactly that the child doesn't like the noise, maybe the sound over there, maybe gathering is not liking, and as soon as they stepped out from that social setting, the child is perfectly fine. While the other child who is throwing tantrum, who is not diagnosed with autism spectrum disorder, he will continue his tantrum, either he is in the situation or he is out of the situation, unless or until he met his demand.
Also, another aspect that I want to ask you, and then I feel that many people have a question towards, is whether this is genetic.
It can be. Like, there are many researches going on about the causes of autism, but still there is no specific reason that is identified.
And Dr. Praveen is shaking her head in agreement. I want to ask her too about this.
Yes, there is a most, the basic ideological causes of the autistic spectrum disorder is the inheritance, chromosomal abnormalities and genetics. And chromosomal abnormalities and genetics and inheritance. And there are some of the research which is supporting the evidence that mothers bearing the child bearing age, there are some of the drugs, and there are some of the toxins, some of the drugs which is those are teratogenics, and air pollution, and these all are factors which can cause, which is the reason. And one of the main cause of the autistic spectrum disorder is there is a synapses neuroamines. There are some of the neuroamines which are responsible for this, and like serotonin, and synaptic there is a synaptic delay, and these all of these factors are determined at the age of development of the child.
And studies also show, Dr. Praveen, that if you have a sibling who's autistic, it's more likely that the other sibling might also,
More chances the other siblings may have.
So my question is that this brings into the nurture versus nature debate. Is it environmental factors that can also attribute towards children developing autism?
Yes, there are air pollution, some of the toxins, like some of the infections. Infections, rubella infections is one of cause of the neurodevelopmental disorder, and there is some evidence that even vaccines can cause, but there is no, it's not proven.
So it's a disputed debate whether vaccinations, and there's a big case going on in the United States.
Really.
Okay, so that's disputed. Now we're talking about how some of the factors in the environment might cause autism, and there's variances in that. But I want to put the question to both of you, and Dr. Kanwal, you can ask first. How do we exactly screen for autism?
Initial screening, there are few symptoms that we can check. For example, the child is responding to the name, to his or her name. Is he maintaining eye contact? Is he following the instructions, like give it to me or put it over there? Is he, or are there any physical symptoms that we can see? For example, hand flapping, as I told you earlier, tiptoe walking. Maybe the child is playing with his fingers, like repetitive movements. If the child is playing with the toys, maybe he is lining up the toys, not exactly playing with the toys exactly the way it is meant to be. Maybe stacking the blocks and just stacking them, not following the instructions. Interest in wheels, circular shapes. So these are the initial screening symptoms that we usually look for.
Okay.
And if we see that the child is showing all these behaviors, then we usually go for the assessment.
Dr. Praveen, would you like to add to that?
No babbling at the age of 12 months. No single word at the age of 16 months. These are the indicators to diagnose that there is something wrong with the patient, with the child's development delay.
And how important is it in this regard, Dr. Praveen, that parents are observant, that they observe behavior that is different from normal behavior, for them to identify these symptoms?
Okay, there is no emotional warmth, no eye contact with the child, and if a mother is pointing the child to some object, child usually follows the hand movement and finger movement and not the object. And if he is involved in some object to play, he can play with a single object for a long time. Basically, there is a no analytic, imaginary thinking is not there. It's just focused, and he can play with the same object for a long time. And sometimes he shows a compulsive behavior, like he puts the things in a order in the same way. And sometimes he shows the sameness in behavior, like he prefers to eat same food daily. Even sometimes the child can have a GI, gastrointestinal disturbance also, but he prefers to eat the same food, and he likes same clothes. He insists to wear the same clothes. And he develops rituals like and stereotypes. Have flapping hands, to and fro rocking movements like this. And
so now that we've established a premise of sorts of what exactly autism is, Dr. Kanwal, I want to ask about the importance of early intervention and how that can perhaps prevent autism from worsening over the years.
Early intervention is, I think, the best thing what we can do for a child with autism. Like if we start working at very initial stages of autism, it definitely prevents the child from moving to the severe category, and he may remain in the mild autism. And the child with mild autism, He can go to mainstream school even without any SNA, without any shadow teacher. He can cope with his academics. Maybe he has no sensory issues, or if he has at the early age, he may has now strategies how to deal with it. So a child with autism, when dealt with at very initial stages of life or up to the diagnosis, it usually gives a best result.
So it's possible that if there is early intervention and it is detected that a child has autism, their life quality, their quality of life in the later years might not be adversely affected to that great of an extent.
Depends if the IQ level is more than 50 and it's detection of the and mother can detect the symptoms at the age of 6 months. At the 6 months, then the prognosis is very good.
So children who have, you mentioned the IQ here.
IQ is approximately near to 50.
So the IQ also varies with children who have autism.
Autism.
There might be a higher IQ for some children and there might be a lower IQ.
But approximately if it is IQ is a 50 and the mother can detect the symptoms at the age of 6 months. And then it's maybe have a good prognosis, and he can go to the normal. 10 to 20% of children can go to the normal school without any support and assistance, and 10 to 20% they need support and the special education system.
Okay, Dr. Kanwal, we're talking about IQ. How can that be detected here? That's a question that many parents might have.
Basically, assessing IQ with a child with autism, it is actually very difficult.
Okay.
There are few tests available that assess the IQ, but usually you cannot rely on the result of those tests because the speech, language, that is a very major component of IQ that is hindered in autism spectrum disorder. So it is usually difficult to say that what is exactly IQ ratio or what is exactly IQ of the child. What I have experienced in my practical life is that child's IQ is usually detected how his response to the therapy. Like maybe two kids started therapy at the same age. One is responding very well and he is overcoming his weaknesses quite fast, but the other child getting the same therapy, still he is not responding therapy to as like the other child. So it means that there is some issue with the IQ level definitely, and usually the child who is having very good IQ in autism spectrum disorder, they comes in the range of what we say is Asperger's disorder. And Asperger's is basically high functioning autism.
Hold on to that thought, Dr. Kanwal. We are also joined by Qazi Fazli Azim, who's a self-advocate for autism. Thank you so much for joining us, Fazli. Fazli, so you were detected with Asperger's at the age of 25. Please share with us your experience.
Right, so the diagnosis was by accident really. I was reading up on research regarding, computer software, and I found out about a person in the US called Brad Cohen who had created a software called BitTorrent, and basically his lawyers were basically, they weren't able to prosecute him because they claimed that he had something called Asperger's syndrome. Now, I never heard about Asperger's syndrome. That's the first time I read about it back in 2006. And when I read about it online, it was quite shocking because they were how they described the symptoms regarding black and white contact, regarding obsessive interest, regarding problems in speech, regarding areas difficulties in social interaction, in communication. All of these I had my entire life. I just didn't have the words to explain to other people.
Entire community needs to work towards. Because as we can see, children with autism, if it's detected earlier, they can be integrated into their normal lifestyle. And even if it isn't, there's immense potential within them. Stay with us, and we're going to go for a short break. Hello and welcome back to Indus Special as we discuss autism. We are now joined by Hasna Nada, who is a specialist in special education and also the proud mother of an autistic child. Thank you so much for joining us. Hasna, I want to hear your experience as a parent who diagnosed her child with autism and how the journey has been so far.
Yeah, hello. Thank you for having me. I'm the mother of an 11-year-old child with autism spectrum disorder. At around 3, he was about 3 years old when we started to notice. 2.5 to 3 years old, we started to notice that his development was not typical. I mean, compared to his siblings and other children, he had a speech delay. He was repeating a lot of things, lack of eye contact, very ritualistic. Like my son, needed things to be done his ways, or it was a crazy tantrum. So by then, I've tried to get different opinions, and he's quite high functioning, so he would kind of fall into the high. I mean, I won't say high functioning as in he can be mainstream, but he has a lot of, nobody with autism is the same. No child is the same as another child, or no person is the same as another person. So my experience was daunting at first. It was hard. A couple of years back, we had very little services around, and I kind of had to build what he needed myself for a lot of parts. But he's come a long way. His speech is great. I mean, he is actually, he expresses himself. He does tend to speak a lot about the same thing, but again, these are all parts of traits of his condition, which is okay. And he's come a long way. I still struggle very much with the academics in school, just because the system don't seem to include or provide enough assistance for children with special needs. It's all a work in progress, and this is happening all around the world, where inclusion. But my son, we were able to give him a lot of speech therapy at the time, a lot of applied behavior analysis, which is ABA therapy, which is pretty much, modifying behavior so the child is able to learn and gain new skills, and also a lot of occupational therapy. We've tried to get him to socialize through social groups. A lot of the things were this community, how would I say, it was like I got together with other families and we would just create these programs until I started my own little center to help such kids.
That's quite remarkable, Hasna, that you created your own system. But it just goes to show that mainstream systems do not do enough to include children with special needs. And Hasna, on that point, I'd also like to include Fazli back into the conversation. He mentioned inclusivity. And Fazli, since you are a self-advocate, how do you advocate for more inclusiveness?
So the first and most important thing in terms of advocacy is sharing my story. Not only my story, but the story of self-advocates around the world. I'm not the only one. I may be the only one on television in Pakistan right now, but I've met hundreds of them in the US, in India, in Bangladesh, across the world, at autism conferences. And these are very gifted individuals. They're just very similar in their stories. They were all of the autism spectrum. They're still on the autism spectrum. However, a lot of them have come a long way because of their parents, because of early intervention. Many of them have succeeded in their fields. They are now, doctors or even PhDs and highly qualified professionals in their fields. They're very happy living independent lives.
How are very, very talented individuals with this. Even Albert Einstein, Michelangelo, all of these very successful individuals, they also suffered from autism. You yourself won a scholarship, you went to study, you won a residency in Harvard, so you are also a very remarkable and talented individual, and that goes to show how individuals with autism need to better be included in society. Thank you so much for joining us, Fazli. With that, I'd like to show a video of a very talented individual, just to show a view of how remarkably artistic individuals with autism can be. Have a look.
Steven is an artistic savant. I think drawing for Steven is like air and water for us. He cannot live without it. I'm Steven's sister. I'm extremely proud of him. Stephen was mute until the age of 5. So drawing was a form of his speech. This was his language. He has a phenomenal memory and is able to memorize cityscapes, landscapes, how many windows, floors, chimneys. To watch the ink touch the paper, it's almost like fine embroidery. You can actually see it develop.
So that was a video showing how talented that individual was. Hasna, I'd like to take it to you. Since you deal with schooling of children with special needs, how exactly do you convince the parents that these children will indeed have a future?
Very much do, and I understand. I mean, I was in denial for as long as at least the first year, I was always hoping it was the wrong diagnosis. All right. So we understand when parents come in, we understand what they're going through. I mean, parents have to go through, it's like a grieving journey in a way. It's not, it doesn't mean that it's going to be a worse life. It's just going to be a different life. So once you can adjust your mind to get to that state, it takes a lot of mourning, a lot of, grieving. And when something happens to your own child, it's, it's harder. It's very, very hard on a parent. So for sure, a parent, we see a lot of denial in parents. The thing with these kids, early intervention is key. So that the younger you get them the services, the younger you get them into, the better the outcomes will be. So I always tell the parents, I understand your journey. Take your time, grieve, go through it, deal with it, and we're here to support you. There's other parents to support you. But at the same time, don't deny your child of services in time. Like, don't go into denial and say, I'm not going to do anything about it, because the younger the child, and all of science proves that, the younger the child receives help and services, the better the outcome later on. So this is the advice I have for parents. It's fine. You're allowed to, go through whatever you're going through. Just get the child the support he needs as soon as possible.
And Hasna, can you tell us about the process of educating children with special needs, how important that is? And I'd specifically like your comments on how parents who can't afford expensive schools, how can they at home help their children?
Okay. This is actually one of the main challenges we face here and around the world, actually. I've noticed this is very common because these services, because they are one-on-one, because your child is gonna need an individualized program. It's not going to be one size fits all, and that's what it is. Special education. That's what special education is. It's adjusting the curriculum according to the child's needs, not the child adjusts to the curriculum like it's done usually in many schools and most schools, let's say. So the process is definitely one of the challenges we have is that it's very expensive to get these. These children. We're talking they need sometimes 40 hours of therapy a week. I mean, that's like in an optimum situation, but at least a couple hours a week, and those are all, in some countries, insurance has started covering, in many countries, actually, insurance can cover these services. It really depends on where you live and how. What you can do at home as a parent, I mean, which is kind of what we have to do here, is read more, educate yourself. For example, you can use strategies in the home to increase the speech, to have the child request things, and to have, little things like maybe putting something in a place where the child can't reach it, so he has to request for it, and not give it to him until he actually uses it. Little strategies in everyday life. The more you know about your child, the more you understand how he functions, the more you're able to help him. Again, don't leave him alone. Don't leave him in his comfort zone. Put him with other children. You know what I mean? Put him in situations where he's actually, don't let them be in their own world and do nothing about it. Like, you have to just continue to stimulate them, help them, teach them how to socialize, teach them how to take turns, teach them social rules. I mean, and they are smart. I mean, these kids are not. This is one misconception that is. IQ usually has nothing to do with autism. I mean, you do have highly severe, you have severe cases where there's an intellectual disability, but everybody can really learn. It's just how do you teach them? And
that's a very important point that you made, and I'd like to move on to how society can play its role a little bit later. But first, we're joined with Dr. Ehsan Nazir, who's a psychiatrist from Doha. Thank you so much for joining us, Doctor. Doctor, so various reports show, and even the World Health Organization states, and Johns Hopkins University stated that there's an alarming rise in autism rates. But my question to you is that, is it actually rising, or is it just now that there is more awareness regarding it?
Thank you for inviting me, and it's a pleasure to join the group. I think this is a wonderful question, and I recently, very recently, and it is going to publish in about maybe in the next couple of months, we wrote about an article about the history of autism and also the prevalence, the rapid increase as by the CDC in the US. It started from like a 1 in 80, then 1 in 67, and now I think the recent data is 1 in 59. Again, there are different school of thoughts. Some people say that there is an actual increase in the prevalence, and other people say, other research studies say it is because the people start knowing more about that. I personally feel like I had experience like about 17, 18 years working in the autism center in the US, and my experience over there shows that I think it's much more aware that's making the people bring the kids to the pediatricians and the primary care doctors, and from there they are getting screened and then going to the child psychiatrist for the further evaluation. As for, I'm not really familiar with any specific studies in which they say that we have identified a toxin or we have identified a gene that is the reason of this increased prevalence of the autism spectrum disorder. So it's a point I think that people can debate on both that.
A child is diagnosed with autism, what are the facilities and services that are needed which might require parents to cope financially with the situation, just to get an estimate of how expensive mental health care is globally, internationally, and in the US?
Let me give you a little bit of I know we are short of time, but let me give you a bit of a background. So most of our group, who is currently working in Doha at Sidra Medicine, we came from the US about 1.5 years ago. And one of the reasons is that Qatar built this 350, 400 bedded hospital. It's a tertiary hospital called Sidra Medicine, and they wanted us to come over here and start developing services in child and adolescent psychiatry. And so we came over here, and one of the things that we did is to recruit people and start establishing more services. The problem that we are having is that there is really no community services over there. And if there are any community services, they are so expensive that people from like a middle-class family, you cannot even talk about the lower-class families. Middle-class families cannot afford that. Let's say like a 1 month of speech sessions, speech and language therapy, it usually costs about 10 to 12,000 riyal. If you have to do ABA, applied behavioral analysis, and I'm not talking about 40 hours per week ABA, I'm talking about maybe like a 6 to 7 hours per week of ABA, and that's costing about 40 to 50,000 riyals. So that's a humongous amount of money that people are paying. So in the end, what they're doing is that they're going to the treatments that are not proven. For example, like there are a lot of places over here which they go for hyperbaric oxygen, they go for immune therapy. And again, that's a hugely debatable issue, but as far as the scientific literature is concerned, we are not very thrilled about the results of those modalities. The benefit in the US is that there are well-established, mature systems in which kids can start getting diagnosed very early in their time, when they're 15 to 18 months of age. And then after that, they usually end up going to the early interventions. If that is the...
Dr. Nazir, I hate to interrupt here, but I do want more information that you're talking about how it can be detected earlier because of mature systems. How do these screening systems work, or how are they more mature than average screening systems across the world? What's special about them?
So I think if you're talking about across the world, we are specifically talking about Pakistan. I think the main issue is the lack of training. ASD, even though it was initially diagnosed in 1944-43 by Kanner, it still is a relatively newer diagnosis because it started picking up the steam in 1990s. And there are quite a lot of people, even the primary cares or the pediatricians, who are not really aware of some of the forms that they can use. For example, like MCHAT, a modified chat is one of the things that we usually use, or the primary cares use. Then there is another one done by Kathleen Lord. It's called SCQ, Social Skill Questionnaire, and those are very simple forms that people can use in the clinic to at least have a good screening protocol. The problem is that in our medical schools, I'm a graduate of Rawalpindi Medical School, and I did not hear about autism until I went for my training in the US and then started learning more in my fellowship. So I think that is where the whole gap is. The more you will train your teachers, the more you will train your psychologists, social workers, and the primary care and the pediatricians, the easier it will be for them to recognize. Because again, if we do not know about a thing, then it's unreasonable expectation that we are going to evaluate a patient and we are going to diagnose that person.
Thank you so much, Dr. Ehsan Nazir, for joining us. It was a pleasure talking to you. I'd like to move on to the aspect of how, as a society, how as individuals, we can treat people with special needs better. And before that, I'd like to show a video of how parents react when they found out that some of their children were involved in the bullying of an autistic child. Let's take a look at that video.
A 13-year-old autistic student at Melcher Dallas High School in Iowa has been severely bullied. He's been punched, teased, and his condition has been mocked on online videos by his students. His name is Levi Null, and local news actually spoke to him and his mother about it, and they showed a few examples of him getting bullied. Well, it turns out that the parents of the alleged bulliers, or bullies, I should say, are totally making excuses for their children, saying that this autistic boy totally deserved it.
And they would do things like throw things at me, throw my stuff out of my gym locker, and call me a lot of names and things like that. And it just became to where it took its toll and I became suicidal.
So both of those videos that you saw were not related, but they definitely showed how there was an impact, how there is an impact on people with special needs when they are bullied. And something that stood out was in the first video, we saw it being said that parents claimed that these autistic children deserved it. So Hasna, I'd like to continue our discussion, and I want to ask you, how exactly do children face obstacles in the society if they have special needs?
Okay, so autism, I mean, as well as other special needs, but autism especially is now a reality nobody can ignore. I mean, with these staggering numbers all around the world. So autism has really now become part of everyday society, and even though people are not educated enough about it, they are starting to be. There's more definitely educating other students, educating society, knowing the signs, understanding. You know, I feel like education is the beginning. Like ignorance, usually these things are fueled, these incidents are fueled by ignorance more than anything. But I mean, I find that I do my son a disservice when I don't explain to people, or when I don't say he has a condition, because he's going to be looked at. I mean, when he does things that at times may be inappropriate. He may, you know, talk too loud or shout or do. And I say, I'm sorry, he has, you know, a disorder. And people, I find that people actually, once they understand, they're much more understanding and compassionate about it. But again, I mean, with so much neurodiversity, I mean, there's so much. I mean, I'm not just talking about autism, I mean, ADHD, and I mean, there's a lot of differences and learning and special needs differences now. It's so common. So there's no more one size fits all.
Hasna,
so
I take your point, and that's a very important point you made. Hold on to that thought. I also want to take the discussion to our studio guests here. Dr. Perveen, so we're talking about how children who have special needs are treated by the larger society. And since you work at the Fountain House, I'd like to take your input on that as well. How does the larger society treat these individuals?
Okay. First of all, when we diagnose patient as autistic disorder, ASD, we should address all the comorbidities the patient is suffering at the same time. We should address those comorbidities, like patients at the same time may be having ADHD, impulsivity, maybe having some epilepsy, hearing problem, maybe. All these the comorbidities should be dealt at the same time. Otherwise, the patient, in the society, the society, what do you mean by society? Like people around the, like not in the institute, outside the institute?
Yeah.
By the society?
Yes, by the society.
Yes, the peer group, the children, they usually ignore and they do not involve the patient and the children with them.
And Dr. Kanwal, since you are a clinical psychologist, I'm sure you face patients who do share their personal experiences of how the wider society treats them. Can you share with us that?
Yeah, definitely. It's like an awareness is, as we are discussing, that awareness is improving day by day, it is increasing day by day. Still, people in our society, they don't accept a child with autism. So what the parents usually do whenever they go to any social gathering, maybe a marriage, maybe any birthday party, they usually keep their child at the home who is diagnosed with autism because the society does not accept them. So that's very depressing for parents, because society, even their very close relatives, didn't accept the child at the home. So definitely there is a need to improve awareness about these, that these children also need to be accepted by the society. Secondly, if we talked about the school situation, there are few schools in Lahore that are now taking children with autism. They provide the facility to the parent and even to the child to interact with their peers. But still, how the peer reacts to them, how they deal with their tantrums within the classroom situation, it is again a very,
Since we're running out of time, I'd like to take the last question to Hasna. Hasna, so do you think in this regard, acceptance is the key in terms of children with special needs, specifically autism, for them to progress, for them to flourish as individuals?
People need to be informed. They need to, and awareness, acceptance and awareness. So, I mean, there's a lot of autism awareness going on, and it has been for the past 10 years, given the very large numbers of diagnoses. So definitely acceptance is key in society. Understanding is key. Understanding that these children do the things they do, not because they're naughty or because they're badly raised, like people assume, like in that video that you just showed, but because there's neurological differences, and it's okay. It's okay to be different. It's not a big deal. And, then the way with these, like I said, with these numbers, it's going to be so common that I find that, acceptance is going to come. It will take some time, but it's going to come. So yeah, definitely acceptance in society is key for these kids to thrive, to be accepted, to enter the education system, to enter the workforce. Just include them, and like I said, they can be included and they should be included. So yeah.
Thank you so much, Hasna, for joining us, sharing your experience with us, sharing your son's experience with us. I'd also like to thank our esteemed guest here in the studios, Dr. Parveen, Dr. Kanwal. Thank you so much for joining us, taking out the time. That's all the time we have for today. See you again tomorrow.